Summer Latombo, your student nurse from Davao Doctors College. And today, I am going to perform the Leopold's maneuver. So the maneuver is the standard palpitation of the abdomen for assessing the fetal position, presentation, and degree of consent. So now, first thing is to perform the hand washing to prevent the spread of the microorganism. Then grade the clients politely. Then introduce yourself as verify a client using the two identifiers as how the clients she would like to call during the assessment. So don't forget to establish a good rapport so that the clients won't feel uncomfortable. So then now explain the procedure to the clients and give the clients the opportunity to raise for her concerns. And so this procedure can be performed with a full bladder. So let the patient empty her bladder first before the procedure because emptying your bladder promotes comfort and of course it allows productive palpitation because fetal contour will not be obscured by the descent bladder. Good afternoon, ma'am. I am Summer Latombo, your student nurse from Davao Doctors College. And so for the verification, ma'am, may I ask your name and your birthday, please? I am Patty Garcia, 26 years old. My birthday, August 5. Okay, ma'am. How would you like me to address you? Pat. Okay, Ma'am Pat. So, Ma'am Pat, allow me to explain the procedure that I will be doing today. So the procedure that I will be doing is that I am going to perform the Leopold's maneuver. So to determine the position of like your baby inside your tummy. So to determine the so I am going to touch some parts of your body. So is that okay with you? It's okay. Okay, ma'am. So do you have any clarification or concerns? I don't have. Okay, ma'am. Pat, so before we start our assessment, you can first urinate in our restroom so that there will be no discomfort once we start our assessment. Okay. So, ma'am, as you can see, I closed the curtains so no other people who can see us. And of course, I will assure you that this won't hurt you and your baby. So, don't worry. So, ma'am, so before the procedure, ma'am, Pat, or the assessment, do you feel any pain or you are uncomfortable? Nothing. Okay, so let's get started. So, first thing to do is to position the patient into the supine position with the pillow under her head and with his knee slightly flexed. This is done for us to facilitate the accurate assessment. Then giving comfort with a slightly flexed knees can relieve the tension of the abdominal musculature. So if you are right-handed, stand at the patient's right and slightly lift her shirt and expose the specific area only. And do not forget to ask permission before doing so. So mom, I am going to expose your abdominal. So is that okay with you? It's okay. So now let's do the first maneuver. So first the patients palpate the uterine fundus to determine what part of the fetus lies in the upper parts of the uterus. So this is to determine if the baby's head feels hard, round, clearly movable and ballotable, and of course the nodular sector. For the second maneuver, palpate the downward outward direction of the side of the abdomen by applying a gently by deep pressure for us to determine the position of the fetal extremities, fetal back, and anterior shoulder. Of course, this is to determine if the fetal back is a continuous structure and the side of the extremities fell nodular and reflect the portion of the feta. So now, for the third maneuver, place one hand in the symphysis pubis and grasp the lower uteri at the segments between the thumbs and the finger feels the presenting parts of this is for us to determine if the engagement has occurred and, of course, if the fetus feels in the pelvis. And also, if the head of the pelvis is in the 0% percentage parts and it's still movable, this is means this is not yet engaged. So in the fourth maneuver, turns the face to the patient's feet to confirm the findings in the third maneuver and determine deflection of the fingers into the pelvis. This is for us to know if the sympathetic prominence is felt in the side and where there is a greater resistance to the descent of the vertex. Then locate the back of the fetus. Then place the stethoscope over it and listen for the fetal heart tone in 1 full minute and for us to know if the baby's heart is normal. We should hear 120 to 116 beats per minute. The application rate character of the fetal heart tone for documentation and record afterwards. Make sure that the patient is comfortable and document the observation, main the fetal findings and presentation, position, attitude, and whether the engagement or the floating to promote the database. For the future and after finishing the procedure, do not forget to wash our hands. Once you're done in your assessment, make sure that your patient is in a comfortable position. Then, note all any unusual findings or any findings that you have found in your patients.